Workplace violence is increasing across emergency departments in the United States. Healthcare workers are among those at highest risk for workplace violence, and emergency departments are a high-risk area for workplace violence from patients and visitors. The Department of Labor's definition of workplace violence is any act or threat of physical violence, harassment, intimidation, or other threatening disruptive behavior that occurs at the worksite. It ranges from threats and verbal abuse to physical assaults and even homicide. It can affect and involve employees, clients, customers, and visitors. This sort of violence can lead to mental and physical distress, affecting a healthcare worker's ability to feel safe in their work environment, ultimately affecting patient care. Previous studies and quality improvement projects have been done to look at workplace violence and understand if certain tools are helpful in minimizing it and improving workplace violence reporting systems. This study aims to explore whether the introduction of a mental health nurse into a community-based hospital emergency department reduces workplace violence. Starting in January 2020, mental health nurses were implemented in the Good Samaritan Regional Medical Center's emergency department during specific shifts to manage patients with psychiatric illness. Data related to workplace violence incident reports from the emergency department was requested from the hospital's risk safety team. These reports were then manually reviewed to determine whether physical or verbal abuse toward a healthcare worker was documented. We also looked at whether a mental health nurse was present at the time of the incident based on the regular mental health nurse shift hours. It was found that a total of 9 patient-related patient safety incident reports were filed since January 2020 when a mental health nurse was implemented. These 9 reports occurred over a 20-month period. In contrast, 10 months prior to mental health nurse implementation, there was only 1 patient-related workplace violence incident report from the emergency department. Of the 9 reports during the period of mental health nurse implementation, 3 involved only verbal or gestural threats, and 6 involved physical aggression. In reviewing these results, having mental health nurse support in the emergency department was not associated with decreased workplace violence. This is contrary to what was expected. This finding may be due to several factors. There may have been increased reporting of workplace violence by the mental health nurse themselves. The addition of the mental health nurse in the emergency department may have also led to heightened awareness of workplace violence and, thus, more reporting by other healthcare workers in the emergency department. Furthermore, a workplace violence committee was also formed at the hospital around the time of mental health nurse implementation, which could have led to increased awareness and reporting of incidents. An important limitation of the present study is that there could have been unreported workplace violence incidents or incidents reported through other systems, such as to hospital security, that were not included. Although we found no evidence of decreased workplace violence with the introduction of mental health nurses in the emergency department, further investigation is warranted using more consistent and comprehensive measures of workplace violence.